Earlier, I posted a short introductory video about endometriosis in which I just gave you an overview about this illness. Today, I am going to discuss this video in detail. This is an often painful disorder in which tissue similar to the tissue that normally lines the inside of your uterus, which is known as endometrium, grows outside your uterus. Endometriosis most commonly involves your ovaries, fallopian tubes, and the tissues lining your pelvis. Rarely, endometrial tissue may spread beyond pelvic organs. With endometriosis, the endometrial-like tissue acts as an endometrial tissue would. It thickens, breaks down, and bleeds with each menstrual cycle. But because this tissue has no way to exit your body, it becomes trapped. When endometriosis involves the ovaries, cysts called endometriomas may form. Surrounding tissue can become irritated, eventually developing scar tissue and adhesions, which are abnormal bands of fiber tissue that can cause pelvic tissues and organs to stick to each other. Endometriosis can cause pain, sometimes severe, especially during menstrual periods. Fertility problems also may develop. Fortunately, effective treatments are available for these conditions. Now let me tell you the symptoms. The primary symptoms of endometriosis is pelvic pain, often associated with menstrual periods. Although many experience cramping during their menstrual periods, those with endometriosis typically describe menstrual pain that is far worse than usual. Pain also may increase over time. Common signs and symptoms of endometriosis include painful periods, which is known as dysmenorrhea. Pelvic pain and cramping may begin before and extend several days into a menstrual period. You may also have lower back and abdominal pain. Then another complaint is pain with intercourse. Pain during or after sex is common with endometriosis. Pain with bowel movements or urination. You are most likely to experience these symptoms during a menstrual period. Excessive bleeding. You may experience occasional heavy menstrual periods or bleeding between periods, which is known as intermenstrual bleeding. Infertility. Sometimes endometriosis is first diagnosed in those seeking treatment for infertility. There are some other signs and symptoms. You may experience fatigue, diarrhea, constipation, bloating, or nausea, especially during menstrual periods. The severity of your pain is not necessarily a reliable indicator of the extent of the condition. You could have mild endometriosis with severe pain, or you could have advanced endometriosis with little or no pain. Endometriosis is sometimes mistaken for other conditions that can cause pelvic pain, such as pelvic inflammatory disease or ovarian cyst. It may be confused with irritable bowel syndrome, which is a condition that causes bouts of diarrhea, constipation, and abdominal cramping. This irritable bowel syndrome can accompany endometriosis, which can complicate the diagnosis. See your doctor if you have signs and symptoms that may indicate endometriosis. Endometriosis can be a challenging condition to manage. An early diagnosis, a multidisciplinary medical team, and an understanding of your diagnosis may result in better management of your symptoms. Now let me tell you the causes. Although the exact cause of endometriosis is not certain, possible explanations include retrograde menstruation. In retrograde menstruation, menstrual blood containing endometrial cells flows back through the fallopian tubes and into the pelvic cavity instead of out of the body. These endometrial cells stick to the pelvic walls and surfaces of pelvic organs, where they grow and continue to thicken and bleed over the course of each menstrual cycle. Then another theory is transformation of peritoneal cells. This is in what is known as the induction theory. Experts propose that hormones or immune factors promote transformation of peritoneal cells, which are the cells that line the inner side of your abdomen, into endometrial-like cells. Then another theory is embryonic cell transformation. Hormones such as estrogen may transform embryonic cells, which are the cells in the earlier stages of development, into endometrial-like cells implants during puberty. Surgical scar implantation. After a surgery such as hysterectomy or C-section, endometrial cells may attach to a surgical incision. Endometrial cell transport. The blood vessels or tissue fluid, which is known as lymphatic system, may transport endometrial cells to other parts of the body. So this is another theory. Then lastly, another theory is immune system disorder, which is a problem with the immune system that may make the body unable to recognize and destroy endometrial-like tissue that is growing outside the uterus. Now let me tell you the risk factors. Several factors place you at great risk of developing endometriosis, such as never giving birth, starting your period at an early age, going through menopause at an older age, short menstrual cycle, for instance less than 27 days, heavy menstrual period that lasts longer than 7 days, having higher levels of estrogen in your body or a greater lifetime exposure to estrogen your body produces, low body mass index, one or more relatives, mother, aunt or sister with endometriosis, any medical condition that prevents the normal passage of flow out of the body, reproductive tract abnormality. So these are the risk factors. Endometriosis usually develops several years after the onset of menstruation, which is known as menarche. Signs and symptoms of endometriosis may temporarily improve with pregnancy and may go away completely with menopause unless you are taking estrogen. Now let me tell you the complications. The first and important complication is infertility. The main complication of endometriosis is impaired fertility. Approximately 1/3 to 1/2 of women with endometriosis have difficulty getting pregnant. For a pregnancy to occur, an egg must be released from an ovary, travel through the neighboring fallopian tube, become fertilized by a sperm cell and attach itself to the uterine wall to begin development. Endometriosis may obstruct the tube and keep the egg and sperm from uniting, but the condition also seems to affect fertility in less direct ways, such as by damaging the sperm or egg. Even so, many with mild to moderate endometriosis can still conceive and carry a pregnancy to term. Doctors sometimes advise those with endometriosis not to delay having children because the condition may worsen with time. Cancer. Ovarian cancer does occur at higher than expected rates in those with endometriosis, but the overall lifetime risk of ovarian cancer is low to begin with. Some studies suggest that endometriosis increases that risk, but it is still relatively low. Although rare, another type of cancer, which is endometriosis-associated adenocarcinoma, can develop later in life in those who have had endometriosis. Now coming to the diagnosis of endometriosis. To diagnose endometriosis and other conditions that can cause pelvic pain, your doctor will ask you to describe your symptoms, including the location of your pain and when it occurs. Tests to check for physical clues of endometriosis include pelvic exam. During a pelvic exam, we manually feel areas in your pelvis for abnormalities such as cysts on your reproductive organs or scars behind your uterus. Often it is not possible to feel small areas of endometriosis unless they have caused a cyst to form. Ultrasound. This test uses high-frequency sound waves to create images of the inside of your body. To capture the images, a device called a transducer is either pressed against your abdomen or inserted into your vagina, which is known as transvaginal ultrasound. Both types of ultrasound may be done to get the best view of the reproductive organs. A standard ultrasound imaging that won't definitely tell your doctor whether you have endometriosis, but it can identify cysts associated with endometriosis, which are known as endometrioma. Another investigation is magnetic resonance imaging, which is also known as MRI. MRI is an abbreviation of magnetic resonance imaging. And this exam, MRI uses a magnetic field and radio waves to create detailed images of the organs and tissues within your body. For some, an MRI helps with surgical planning, giving your surgeon detailed information about the location and size of endometrial implants. Laparoscopy. In some cases, your doctor may refer you to a surgeon for a procedure that allows the surgeon to view inside your abdomen, which is known as a laparoscopy. While you are under general anesthesia, your surgeon makes a tiny incision near your navel and inserts a slender viewing instrument which is known as laparoscope, looking for signs of endometrial tissues outside the uterus. A laparoscopy can provide information about the location, extent and size of endometrial implants. Your surgeon may take a tissue sample, which is biopsy, for further testing. Often with proper surgical planning, your surgeon can fully treat endometriosis during the laparoscopy so that you need only one surgery. Treatment. Treatment for endometriosis usually involves medication or surgery. The approach you and your doctor choose will depend on how severe your signs and symptoms are and whether you hope to become pregnant. Doctors typically recommend trying conservative treatment approaches first, opting for surgery if initial treatment fails. Pain medication. Your doctor may recommend that you take an over-the-counter pain reliever such as non-steroidal anti-inflammatory drugs, for example ibuprofen or naproxen sodium. These will help ease painful menstrual cramps. We may recommend hormone therapy in combination with pain relievers if you are not trying to get pregnant. Now let me tell you about hormone therapy. Supplemental hormones are sometimes effective in reducing or eliminating the pain of endometriosis. The rise and fall of hormones during the menstrual cycle causes endometrial implants to thicken, break down and bleed. Hormone medication may slow endometrial tissue growth and prevent new implants of endometrial tissue. Hormone therapy is not a permanent fix for endometriosis. You could experience a return of your symptoms after stopping treatment. Therapies used to treat endometriosis include hormonal contraceptives. Birth control pills, patches and vaginal rings help control the hormones responsible for the buildup of endometrial tissue each month. Many have lighter and shorter menstrual flow when they are using a hormone contraceptive. Using hormonal contraceptives, especially continuous cycle regimes, may reduce or eliminate pain in some cases. Gonadotropin-releasing hormones, agonists and antagonists. These drugs block the production of ovarian-stimulating hormones, lowering estrogen levels and preventing menstruation. This causes endometrial tissue to shrink. Because these drugs create an artificial menopause, taking a low dose of estrogen or progesterone along with GnRH agonists and antagonists may decrease menopausal side effects such as hot flashes, vaginal dryness and bone loss. Menstrual periods and the ability to get pregnant return when you stop taking the medication. Progestin therapy. A variety of progestin therapies, including an intrauterine device with levonorgestrel, that is known as Mirena or Skyla, contraceptive implant, Nexplanon, contraceptive injection, Depo-Provera or progestin pill. These are the options. These can halt menstrual periods and the growth of endometrial implants, which may relieve endometriosis signs and symptoms. Then another group of drugs is known as aromatase inhibitors. These inhibitors are a class of medication that reduce the amount of estrogen in your body. Your doctor may recommend an aromatase inhibitor along with a progestin or combination hormonal contraceptive to treat endometriosis. Now coming to the surgical options. First, let me tell you about conservative surgery, which is a common and popular procedure. If you have endometriosis and are trying to become pregnant, surgery to remove the endometriosis implants while preserving your uterus and ovaries may increase your chances of success. If you have severe pain from endometriosis, you may also benefit from surgery. However, endometriosis and pain may return. Your doctor may do this procedure laparoscopically or less commonly through traditional abdominal surgery in more extensive cases. Even in severe cases of endometriosis, most can be treated with laparoscopic surgery. In laparoscopic surgery, your surgeon inserts a slender viewing instrument, which is known as laparoscope, through a small incision near your navel and inserts instruments to remove endometrial tissue through another small incision. After surgery, your doctor may recommend taking hormone medication to help improve pain. Fertility treatment. Endometriosis can lead to trouble conceiving. If you are having difficulty getting pregnant, your doctor may recommend fertility treatment supervised by a fertility specialist. Fertility treatment ranges from stimulating your ovaries to make more eggs to in vitro fertilization. Which treatment is right for you depends upon your personal situation. Then another option and last option is hysterectomy with removal of the ovaries. surgery to remove the uterus, which is known as hysterectomy, and ovaries, which is known as oophorectomy, was once considered the most effective treatment for endometriosis. But endometriosis experts are moving away from this approach. I mean, nowadays this treatment, hysterectomy and oophorectomy is not so popular. Okay. And nowadays, experts are moving away from this approach, instead focusing on the careful and thorough removal of all endometrial tissues, as I told you in laparoscopy. So laparoscopy is a more popular procedure nowadays. Okay. Having your ovaries removed results in menopause. The lack of hormones produced by the ovaries may improve endometriosis pain for some, but for others, endometriosis that remains after surgery continues to cause symptoms. Early menopause also carries the risk of heart and blood vessel diseases, certain metabolic condition, and early death. So this treatment, hysterectomy with oophorectomy, is not so popular nowadays because of these risks and complications which I just told you. Okay. Removal of the uterus can sometimes be used to treat signs and symptoms associated with endometriosis, such as heavy menstrual bleeding and painful menses due to uterine cramping, in those who do not want to become pregnant. Even when the ovaries are left in place, hysterectomy may still have a long-term effect on your health, especially if you have the surgery before the age of 35. Finding a doctor with whom you feel comfortable is crucial in managing and treating endometriosis. You may want to get a second opinion before starting any treatment to be sure you know all of your options and the possible outcomes. Now let me tell you something about lifestyle and hormone remedies. Okay, if your pain persists or if finding a treatment that works takes some time, you can try measures at home to relieve your discomfort. Warm baths and a heating pad can help relax pelvic muscle, reducing cramping and pain. And over-the-counter non-steroidal inflammatory drugs, which I told you already, such as ibuprofen and naproxen, can help ease painful menstrual cramps. So this was my detailed video about endometriosis. I hope you like this video.